Hi, my name is Dr. Nolan Wessell. I'm a faculty member at the University of Colorado, Department of Orthopedic Surgery, Division of Spine Surgery. I'd like to speak to you about cervical radiculopathy. Cervical radiculopathy is the medical term used to describe pinching of the nerves in the neck. To help you better understand cervical radiculopathy, we should first begin by reviewing the basic anatomy of the neck and the spinal cord. The spinal cord exits at the base of the skull and is the main conduit responsible for transmission of nerve or electrical signals from the brain to the other nerves of the body. You can think of the spinal cord as the main power cable entering the back of your home, and the nerves as the small branches of electrical wires that go out to each individual room. Cervical radiculopathy can be caused by a variety of different conditions, including disc herniations, bone spurs, or even cysts from small joints in the back of the spine called facet joints. The symptoms of cervical radiculopathy can include pain, numbness, or even a burning and tingling sensation that spreads from your neck into the arms or hands on either side of your body. Sometimes, patients will feel weakness in certain muscle groups in the arms or hands, but fortunately, we can often help. If you feel any of these symptoms, you should begin by seeking care from a University of Colorado orthopedic spine provider to evaluate you via physical exam. Your doctor will ask you very specific questions and will perform a careful exam to ensure that you do not have findings of another condition called cervical myelopathy, which can be much more severe and involves pressure on the spinal cord itself. After discussing your complaints and examining you, your doctor will obtain x-rays of your neck. In certain circumstances, your doctor may even feel that it's necessary to get additional images. This will often include either an MRI or a CT scan. By reviewing the MRI and the CT scan, your doctor can help to determine the health of your discs, the alignment and stability of your spine, the amount of degeneration or wear and tear in the joints of your neck, and even the amount of pinching of the spinal cord or nerves if you have it. It is important to understand that rarely, if ever, are narcotic medications required or even helpful in the treatment of nerve pain. But by the time most patients come to see us, they have already started taking anti-inflammatory medications and nerve medications such as gabapentin or Lyrica, which are frequently prescribed by their primary care physician. In our practice, the treatment of cervical radiculopathy often begins with physical therapy. Here, you will learn exercises to improve your motion, increase your neck strength, and even break up scar tissue around the nerves. All of this can lead to dramatic improvement in your quality of life. We recommend that these exercises become part of your daily routine, just like brushing your teeth. If physical therapy and anti-inflammatory medications do not solve the problem, the next level of treatment is often injection-based therapies. This method uses x-rays to accurately place a needle around the opening for a nerve. We then inject a small amount of anesthetic or numbing medication and a steroid around the nerve. This works to numb the pain and also to decrease the inflammation around the nerve to improve your symptoms. If you have failed to see improvement from anti-inflammatory or nerve medications, physical therapy, or injections, your surgeon will discuss the risks and benefits of surgery and help to determine whether or not it will help you with your specific condition. Surgery for cervical radiculopathy most often involves one of two options, either disc replacement or fusion. The terms used to describe these surgeries are anterior disc replacement, or ADR, and anterior cervical discectomy and fusion, or ACDF. A number of research studies have found that both methods can be very effective. Both options involve creating a small incision in the front of the neck to access the spine. The disc at the level of the pinched nerve is removed, and small instruments are used to relieve the pressure around the affected nerve. Once the pressure around the nerve is released, either a disc replacement device or spacer, called a cage, is placed into the disc space. The disc replacement most commonly uses two small pieces of metal that are separated by a thin piece of plastic that allows the device to move, as opposed to being locked into place, which is what occurs during a fusion. If you are having a fusion, a small amount of bone graft is placed into the cage to help the bones grow together. The final step in the fusion procedure is to secure the cage into place using a small metal plate and screws. There are many ways that we can treat your cervical radiculopathy. Your first step is to meet with a University of Colorado orthopedic spine specialist for an evaluation. From there, we can work together to design a treatment plan that suits your unique needs.